Hello, my name is John Kisiel. I'm a gastroenterologist at Mayo Clinic specializing in the care of patients with inflammatory bowel disease. I've been given the opportunity today to make some comments on a recent study published in the journal Gut by Laurent Bogerie and colleagues, which assessed the risk of cancer in patients with inflammatory bowel disease treated with immunosuppressants. Specifically, this study looked at patients who had a prior history of cancer to determine whether or not that history and the use of immunosuppressants had any interaction. This is a very important question for clinicians and patients alike. We know that patients who are on immunosuppressants do have an increased risk of developing cancers, and in particular that risk appears to be increased in the medicine class called thiopurines, which includes common drugs like Imuran or azathioprine and 6-MP, also known as mercaptopurine or the brand name Purinethol. This risk appears to be quite high in patients who take these medicines after a solid organ transplant, but we've also seen an increased risk in certain types of cancers like lymphoma and non-melanoma skin cancers in patients with inflammatory bowel disease. These medicines are very effective for inflammatory bowel disease, especially when combined with another medication class, the anti-tumor necrosis factor alpha drugs such as Humira, Remicade, Cimzia, or golimumab or Simponi. The aim of this study was to try to figure out whether or not patients with a prior history of cancer were any more likely to develop new cancers or recurrent cancers if they were treated with immunosuppressing medicines. To answer this question, the study investigators enrolled a very large cohort of patients. This is known as the Sesame or Sesame cohort, depending on how you want to pronounce it. This was a group of about 700 gastroenterologists across the entire country of France. Enrolled all of their patients into this study for a full year with nearly 20,000 individuals that were able to participate in the study, and these patients were followed forward in time using the medical record. This sample set included about 400 patients who had a prior history of cancer, and then after enrollment in the study they were followed forward over time to see which patients developed new cancers or had recurrent cancers. Now, if you had a prior history of cancer, you were more than twice as likely, or almost twice as likely, to develop a new cancer over the follow-up period during the study, and that's fairly alarming. But when the investigators looked at other risk factors for developing cancer, age was clearly a risk factor. We already know that that happens commonly with cancer in this country and other countries as well. And interestingly, if you were taking an immunosuppressant in the past or during the time period of the follow-up in the study, you were not any more likely to develop a new cancer. So patients with prior cancers treated with immunosuppressants appeared to have the same risk as patients with prior cancers not treated with immunosuppressants. I think this is a very important finding, and I think this is good news for our patients. Specifically, it means that even patients who have a prior history of cancer can be treated aggressively for their ulcerative colitis or Crohn's disease using modern combination immunosuppressing therapies. I think we have to look at this study with a little bit of caution because the study had too few patients in it to see whether or not there was an increased risk for lymphoma or other types of skin cancer. And so I think if you actually have a history of lymphoma or melanoma type skin cancer, we still need to be very cautious in using immunosuppressants. But I think for most patients with prior histories of effectively treated solid tumors, things like colon cancer or breast cancer, as long as the disease is clearly in remission, especially if it's 5 years out from treatment, I think we can go ahead and give these patients the full court press with regards to treating their inflammatory bowel disease, which can cause significant disability over the course of their lifetime. So overall, I think this study is a very positive report for care of our patients with inflammatory bowel disease. Thank you very much.